And did you know that smokers sometimes have an altered smell and taste? Most times, smokers don't taste a delicious meal the way we taste it because their taste buds are affected. And of course, if anything is going to change how the gum tissue is, it can slow down any kind of healing process after a dental procedure, such as extractions and surgeries. And if someone is smoking just after an extraction, they can develop a complication we call a dry socket. And that can be very painful, unnecessarily, right? So if you know a smoker that is about to have an extraction, warn them: no smoking, no smoking, no smoking. Of course, we know that people who smoke often have dry mouth, and we know that that makes them more prone to tooth decay, gum disease, and of course, oral infections. So we want them to quit smoking. If we can direct them to a smoking cessation program, that would be great. We want their hygiene to be super great. We want to check them regularly, especially the oral cancer screening part of the exam. We want them to be well hydrated. We want them to be moisturizing with sugar-free gum chewing or sugar-free candy sucking, anything to keep that saliva stimulated and flowing. And of course, we want to limit those sugary, sticky snacks that really not going to work in their favor. Bottom line, good oral hygiene leads to good overall health. If you can get those patients to stop smoking, that would be the best thing ever. But in the meantime, we're going to maintain them, keep their teeth clean, do a good oral cancer screening. If we see anything, get it checked out immediately, because they can't see or feel what we can see. So if your patient is a smoker, pay special attention.